So chiropractic is all about allowing communication between the brain and the body. How does that fit into our topic about pregnancy? Well, a lot. Because pregnancy has its own stresses, and pregnancy may not allow the use of some conventional medicine, especially when it comes to pain, things like that. So we're going to kind of talk about that a little bit. Your spine is going to function at its absolute best when it's in good position, meaning it has proper curvature of the spine, and that it's straight from the front, and it has good mobility. Proper spinal function and structure will allow the brain and the body to communicate at its best potential. Any inhibition to these nerves, even the weight of a dime, can shut off up to 60% of the life force or nerve flow from the brain to different parts of the body. If the spine has extra stressors on it, which we all have horrible habits of daily stress to put that under, just imagine a growing fetus and a mom that starts to stress and strain the body. It actually has been proven that about 75% of all pregnant moms have some back pain, and some have it earlier than others. Many of my mothers who come in for treatment would say that, oh, my first baby, I had it in the third trimester. My second baby, I had it in the second trimester. And my third baby, I almost had it right away. Our body learns patterns, and if the body isn't readjusted, recorrected, the dysfunctions and compensations to the initial pregnancy aren't undone. Just like conditions that we have in our body where we have injuries or accidents, if we're not fully corrected from them, then we have another injury on top of an old compensation. And this is how chronic conditions start, is because we have one injury that's not fully corrected and another one with poor posture, a lot of stress, and poor diet. It's a recipe for disaster for our bodies. And a lot of times moms who have challenges already in their spine seem to perpetuate themselves or really shine light on a problem when they become pregnant, because we add more stress, right? We add more stress. Pregnancy has a significant amount of stress, as we talked about, on the lower back, but also if you think about it, usually as the belly grows, the hips will shift forward, allowing a lot of stress and strain on the body, but that also then causes the head to come forward. So pregnancy as a whole can be supported with proper chiropractic care. The first question most people have, and we're talking about safety of chiropractic care with pregnancy, is it safe? Well, I can tell you the studies that have been done, which isn't a lot of them, have showed no side effects of getting adjusted to pregnant moms. It's very safe. The body, if adjusted properly and techniques adjusted to the pregnant mom, usually produces actually better outcomes for the pregnancy, which we'll talk about in a moment. But let's just stick to the safety a little bit and think about medications. If 75% of moms are in pain to some degree with a pregnancy, then that means usually probably one of their only safe options, I looked through the research, is maybe, and this is considered by the medical community safe, is Tylenol, which is about the only one, and even longer term, that has side effects for the growing baby if taken long term. But short term has been shown to be pretty safe. But if any medication is worried or concerned when you're pregnant, what makes it okay to take when we're not pregnant? You know, there's always side effects. I guess the fact is a medication, in order to even be considered a medication, actually must pass a certain test in which at a certain dose of it, it kills a lab animal. It's called a lethal dose. So that means that all medication at some point could be toxic and harmful. So we're all different. We all are affected in some way by medications. If our bodies maybe are helped with some pain, but there's toxicity that builds up and we're already toxic, there could be ramifications. Know this, a growing fetus is probably its most sensitive, and most sensitive early in the first 6-12 weeks of pregnancy. The great part about the nature of how we develop is that baby is actually not attached to mom's blood supply immediately, which is good, because mom doesn't usually know that she's pregnant. So the fetus, though, when it becomes connected to the mom as blood supply, is very apt at neurological mutations. This is why having enough B12 and B9, folic acid for moms that right away before they get pregnant, because the baby, when its nervous system is developing, which is one of the very first systems to develop, is very sensitive. That's when malformations and even kind of spontaneous abortions happen, because the body is become too toxic or too deteriorated in some way that the fetus wouldn't live. And that happens very, very early, probably almost earlier than you might even know that you're pregnant to some degree. But the body is very sensitive, so medications early on, or sometimes people are probably on medications that might be somewhat toxic before they even find out that they're pregnant, which can be a challenging thing. But just pain medications, almost all pain medications are not allowed during pregnancy, especially the heavier duty ones. So the fetus development starts with brain development, number one. So the very first thing that happens in a fetus is the brain develops. It's a little bit of gray matter is formed. So at the moment of conception, you actually have a little bit of gray matter. That initial energy and innate intelligence is the brain. After the brain develops, your spinal cord develops, called a notochord. And that's within, a couple weeks. It's very quickly develops. Those two systems are the basis of how the rest of the whole fetus will develop. So people will say, well, the heart's super important, but it won't even develop unless the nervous system has set down itself properly. The intestines, the lungs, all these things are important, but those don't develop until after the spinal cord. So this is why chiropractors adjust and try to assess the nervous system, because the very first system to develop was your nervous system. It's the most important. How do I know it's important? Well, because the skull protects your brain, which is the very first thing to develop, and the spinal column, the bones of the spinal column, protect your spinal cord. Those are the strongest bones we know of. If you think about it in relation to the ribs, much stronger than our ribs, correct? And what do our ribs protect? Gosh, some vital stuff, our heart, our lungs, our liver, but to our body's priority system, the most important, brain and spinal cord. That's why you're getting adjusted. This is why chiropractic is holistic. We want to allow that holistic communication. Back to pregnant moms. Why is it so important to try to keep moms from having to take medications? Because they probably all have some side effect. And for everyone, it's a little different. And there's very little options for pain. Chiropractic is a great benefit to pain. The research shows that after even a couple adjustments, 50% of moms had pain relief. And after a couple more weeks, I think it was 75 to 80% had resolved their pain. So research shows that of the small studies we've done, that moms were very satisfied with their care. They had reduced pain. So if pain was the only thing we're talking about, there's a huge benefit to moms getting checked early and probably even pre. So there's lots of moms who take a prenatal. They think they may be pregnant. They should be doing pre-chiropractic. They should be getting adjusted and getting their pelvis checked for alignment issues early on, because it probably could stave off problems until later on in their pregnancy just from the size of baby. Safety, absolutely. Is it safe for the alternative? Not as much. It's much safer to have chiropractic care than medical care for the pregnancy, at least pain-wise, and in any aspect. The second aspect of chiropractic, or what are some of the benefits that we can receive from chiropractic care? Well, besides pain relief, there have definitely been some studies that show that the body's reaction in the pelvic floor, the pelvic musculature, is improved with chiropractic care. So Braylon, I think we're going to try to show that video. We're going to watch about 3 minutes, all right? This will talk a little bit about some of the other benefits.
But what does the research tell us about the benefits of seeing a chiropractor while you're pregnant? When it comes to back pain, not many big studies have been done yet that have looked at whether chiropractic care helps. So although more research is needed, results from the research that has been done so far are promising and seem to show that for some pregnant mums, chiropractic care can be really helpful. In one study, researchers in Switzerland followed 115 pregnant mums for a year who went to see a chiropractor with low back pain. What they found in this study was that over half of the patients said that they improved after just 1 week of chiropractic care, and after a month, that figure had grown to 70%. By the end of the study, about 90% of pregnant mums said their pain was better. From this study, we can't be sure if it was the chiropractic care that really helped them, but at the end of the study, over 85% of the mums said they were happy with the care they received from their chiropractor. One other area that researchers think chiropractic care may help pregnant mums is with the delivery of their baby. For women in labor, the ability to relax and contract her pelvic floor muscles is really important for helping baby to move through the birth canal. Ideally, for the birth process to go as well as possible, giving the greatest chance for a natural vaginal birth, you want strong pelvic floor muscles that can relax and contract at just the right times. In a study conducted in New Zealand, researchers studied pelvic floor muscle function in pregnant women before and after they were adjusted by a chiropractor. What they found was that after the pregnant women were adjusted, their pelvic floor muscles appeared to relax more. This relaxation of their pelvic floor muscles after they were adjusted may mean that chiropractic care could help them to have a natural vaginal delivery. This was only a small trial, and the researchers couldn't be sure how much of an impact these relaxed muscles would have on labor itself, but it does suggest that for pregnant mums, chiropractic care may give them some control over their pelvic floor muscles, which may make childbirth easier. Other research supports this idea, with one study reporting that new mums experience on average a 25% reduction in the length of labor time with chiropractic care during pregnancy, and that rises to a 31% reduction for mothers who have given birth before.
So, I'll repeat. So what does it mean to help with the pelvic floor? Well, number one, I can tell you is that chiropractic care, when properly adjusted, mom are able to have better control and connection in the musculature that surrounds the pelvis. Most problems of dystocia, which is just slow labor, is because there is a miscommunication between the brain and the pelvis. And if the body is communicating better, there's better control. If we're removing subluxations within the pelvis or within the spinal column in the lower spine usually, then that allows the nerves to communicate to the muscles of the pelvic floor. I can tell you that the pelvic floor is a topic in which, since I started care, there are pelvic floor therapists, so many more than there ever was, because the pelvic floor becomes very weak when we sit a lot, when we're not strong, we're not engaged, and the pregnancy really makes a challenge to that. So chiropractic care helps to enable the strength and the support of the pelvic floor. The pelvis itself, when women become pregnant, usually becomes more open and actually looser. There's something called relaxin that is released into the spine, especially as the pregnancy develops, that allows the pelvis to open up more. That instability, for lack of a better term, that allows the pelvis to move more so baby can be delivered, also causes a lot of problems. We specialize in allowing and improving the pelvic position, not just with forceful adjustments, but also low force adjustments to allow the pelvis to get in its best position. And sometimes we even use, we call them belts or SI belts, that hold the pelvis a little bit more together so that the mom feels stronger and has less discomfort in these SI joints. These joints are a big problem for pregnant moms. If we can help the alignment and the function around those joints, then again, we can help the delivery for mom and the safety for the baby. Most moms that come into our office, maybe even coming after a C-section, they're trying to do a vaginal birth after C-section. And so we want to focus on making sure that they have every ability to utilize the muscles around their pelvis and that's in good position. Breech presentations are very common, and we see a number of moms come in saying, "Hey, will you turn my baby?" No, I don't turn anyone's baby, just for the record. We don't try to force the baby to move. But I can tell you this, I'm specialized in a technique called Webster technique, who was developed by Dr. Webster because his daughter was pregnant and had a breech presentation. He was a chiropractor, and he developed a system in which would help the pelvic position to improve itself, to give relaxation to the round ligaments, to assess the musculature around the pelvis so that those muscles weren't twisting and distorting the pelvis in a way that baby had room to flip. So the Webster technique has been very successful. I mean, it probably was started back in the 70s, maybe even in the 80s. And the Webster technique, I've used many a times, seen many successes with it. Not every single one, but many. Because our goal is not to force the body, but to allow the body back to its normal function. And that means aligning the pelvis, improving the function of the lower spine. And obviously exercises are important, but the right ones. We're huge for moms on the balance discs that we sell here and that we put on the chairs. You can do little figure eights on those big exercise balls or balance discs. Those are great for the pelvis and SI stability. So know that when it comes to pregnancy, there are factors in which it's much safer to be adjusted than probably to take the medication. That alignment of the body and the pelvis not only will help mom during the delivery, but may help baby, especially if baby is in a bad position. And third, chiropractic care allows the body to function at its best. And doing that early, not just later, when a lot of times I'll see moms, they're 36 weeks, they're dying, help me out, and we can have some success. But the reason we're giving these workshops is so people can understand, hey, what else? What should I be aware of, and who should I be sending in there to get checked? Because we don't want to go to a point where it's a little hard for us to make as much of a success. So pregnancy and chiropractic go together. You know, they're like peanut butter and jelly. They should fit. And the reason for that is the body has a natural ability to do what's required of it. But in today's society, we have a toxic environment in many ways. We sit too much. We don't have the right nutrients. The amount of stress, especially on a mom, increases exponentially and really affects delivery. It affects many of the muscles, the tension. We talk about the pelvis trying to relax. If your mind is under stress, so are every muscle in your body. They're just end receptors. When you get adjusted, it helps to put your body at least in a reset place for a short amount of time, which usually allows moms to deliver. I can't tell you the amount of moms who had a pregnancy or delivery before being under chiropractic care, and then maybe one after and stated really good results. Like, this delivery was so much better.